uterine infection in dairy animal. स्क्रीन विजिबल है सभी को ना?
हाँ सर विजिबल है.
So this is the overview of today's discussion. First, we will start with the introduction of the uterine infection. Then we will see what are the different types of uterine infections are there and which are common in the dairy animal. Thereafter, we will be discussing what are the common predisposing factors or risk factor which make a dairy animal more prone or susceptible to get the uterine infection, and what is the basic etiology of the uterine infection. What are the different bacteria which are responsible for development of the uterine infection. Thereafter, we will be discussing about the basic pathogenesis, how the uterine infection develop inside the animal uterine tissues, and after the development, how we can diagnose the condition. Because for the proper therapeutic management, diagnosis of a particular condition is imperative. Unless or until we could not diagnose the condition, then the therapeutic management will also be incomplete. So we will see what are the different ways and advancement in the field of reproduction to diagnose the uterine infection. Then we will see what are the therapeutic approaches we are having, how we can manage a particular uterine infection case with a selective therapeutic approach. And lastly, we will see the preventive measures in the dairy farming. There are certain preventive steps which each and every farmer should adopt so that the incidence and the occurrence of uterine infection can be minimized, because prevention is always better than the cure. So if we will be able to prevent the incidence, then obviously our dairy farming will be sustainable in the manner. Otherwise, the economic burden will be increased and the sustainability of the dairy farming will be questionable. And finally, we will conclude our talk that what will be the take-home message for today's discussion. So let's start with the introduction. Why we are saying that the uterine infection or management of the postpartum uterine infection is the sustainable key for a dairy farming? Because reproductive well-being is very essentially linked with the production potential of the animal. If animal is not performing well in the terms of reproduction, then obviously the production potential of a particular animal will also be compromised. And if production potential will be compromised, then obviously economic viability will be lower down. Okay, so whatever the profit or benefit we are having from a dairy business, that profit will be curtailed. So basically, the postpartum uterine infection will challenge the successful reproduction. And how we can have idea, because the gross measurement or the crude measurement of reproduction in any dairy setting is one calf a year. If farmer is getting each calf a year, then broadly we can assess that reproduction is going well. If this particular calving interval is extended beyond the 1 year, suppose we are having 1.5 year interval in 2 subsequent calving, then obviously something is not going well in terms of reproduction, and ultimately our successful reproduction is challenged, and accordingly the production potential will also be compromised, and obviously the economic benefit will be lower down. So how we can manage the successful reproduction? This answer of this question is lies in the management of the periparturient period. We will be discussing in the later part that what is the periparturient period and how its management is very much critical for the successful reproduction. Because in this particular period, if we are committing any error or any mistake, then the microbial contamination of genital tract or further its colonization will be there in the uterine system or uterine tissues, and ultimately it will lead to the postpartum uterine infection. And in this sketch or diagram, we can see if during the transition period, if animal is got developed the postpartum uterine infection, what will be the possible consequences over the animal's reproduction? Due to the uterine infection, the involution process or cleaning or clearing of the uterine debris or the placental parts or the fetal remnants will be delayed. So ultimately, uterine involution will be delayed. If uterine involution will be delayed, so subsequently the ovarian rebound or resumption of the ovarian function will also be delayed. So the postpartum estrus onset will be delayed. Service period will also be increased. Days open will also be increased. And particular animal will be exposed for the increased number of the service for each conception. Open days will also be increased. And ultimately, what crude measure we have discussed, the calving interval will be higher in a particular case. Okay. Why these fertility parameters are increasing? Because due to the postpartum uterine infection, ultimately animal is suffering from any of the reproductive disease, either any stress or repeat bleeding syndrome or uterine infection or other disorders. So in all these types of the uterine infection, you can see the share of the uterine infection. It is nearly 30% in the reproductive disorder. So majorly, whatever the kind of reproductive challenges we are facing, the most of the time it is because of the uterine infection. So that's why the management of postpartum uterine infection is very much critical for a sustainable dairy farming. So this is the incidence worldwide of the uterine infection, and you can see these are the developed countries where the incidence of uterine infection is very, very less. And here in the developing nation, or particularly in case of India, you can see the incidence of the uterine infection. It is more than 30% incidence of the uterine infection is there, and this is the major challenge for the successful reproduction. And that's why we are having the highest milk production, we are having the very high population of the dairy animal, but ultimately the reproductive efficiency of these animal is very less as compared to the other part of the world. So now we will see the now we will start our particular topic of the uterine infection. We have completed the introductory part. So uterine infection is basically a most frequent occurring infertility issue in case of dairy animal, and generally it will be observed in the postpartum period. And if we wish to classify the different types of uterine infection based on the different characteristics, so these are the major types of the uterine infection: puerperal metritis, clinical endometritis, subclinical endometritis, and pyometra. And we are going to discuss each and every uterine infection category in detail. So why this particular uterine infection is going to be developed in dairy animal? Because during the process of parturition or the event of the parturition, generally what the physical barrier we are having in terms of vulva, labia, or vagina, all these physical barrier are become weaker. A structural barrier are compromised during a particular physiological event of the calving. So the entry of the microbial organism is very easy. So generally the microbial contaminants of the environment will enter in the reproductive tract. In the reproductive tracts, various immunity levels are there in terms of innate immunity or the adaptive immunity, and they will try to minimize or ameliorate the microbial contamination in the uterine lumen. If the immunity portion is on the higher side and the microbial contamination will on the lower side, then the obviously animal will win and the uterine infection will be curtailed, or we can say the uterine infection will not be allowed to develop in the uterine tissues. However, in the other side, if the immunity part on the lower side and the microbial contamination on the higher side, so subsequently the uterine infection will be developed. Detailed pathogenesis we will be discussing. So first uterine infection or first category is the puerperal metritis. So what is the puerperal metritis? Generally, it is kind of uterine infection which encountering all the layers of the uterus, perimetrium, myometrium, or endometrium. And generally, this uterine infection will be encountered during the puerperium period. So one should be aware that what is the puerperium period? It is immediate postpartum period in the dairy animal. Generally 2 weeks, 3 weeks, or 4 weeks in different animals or the breed. And this is particular period is concerned with the structural and functional restoration of the genital organ nearly to the non-gravid state. So if in this particular period, if animal is catching the uterine infection with these characteristics, then it will be defined as the puerperal metritis. So generally such kind of uterine infection will be encountered in the first 3 weeks of the parturition. How it will be categorized? Abnormally enlarged uterus. Whatever the rate of involution is there, this rate will be slower down. Okay, so comparatively the uterus will be enlarged and fitted watery red brownish uterine discharge will be observed, along with the necrotic debris of the placenta, fetal membranes, and the endometrium. And most importantly, the animal will be manifesting the systemic illness in terms of high temperature, off feed, dullness, depressed, and reduced milk yield. These systemic manifestation will be observed along with the this particular nature of the uterine discharge or in this particular window of the postpartum period. So in this particular period, this particular characteristics will be defined in the category of puerperal metritis. Second one is the clinical metritis. Okay. As you are encountering the term metritis, so again, all the tissue layers of the uterus will be inflamed, and generally it is also been encountered in the same window of the after the parturition, but nature of discharge will be entirely different. As you can see here, the discharge nature will be purulent in the category. An animal will not be manifesting any systemic illness. Okay, so here, based on the nature of discharge and the systemic signs, we can differentiate between the clinical metritis and the puerperal metritis. Okay. Third one is the clinical endometritis. As the name itself is indicating, it is the inflammatory condition of the endometrium only, not all the layer of uterus. And generally, the infection will not penetrate deeper than the stratum spongiosum layer. As you can see in sketch, that this particular depth of the endometrium will be covered during the infection of the clinical endometritis, not deeper than this point. Okay. And how it will be characterized? Purulent or mucopurulent discharge will be observed based on the content of the pus or mucus in the discharge. And generally, it will be detected after the 3 week of the parturition or post 21 days of the parturition. So detection window and the nature of discharge again will be helpful for the detection of uterine infection. And obviously here also the prominent systemic illness will be missing. Animal will be apparently healthy in terms of fever, in terms of feeding, whatever kind of systemic health is there. Then the subclinical endometritis, and this is very most dangerous type of uterine infection because it is subclinical in nature. Whatever the latent or hideout infections are there, they are generally more critical to manage in case of health management because they are not visible externally. They are not manifesting appropriately in case of animal health. So subclinical endometritis is nature of uterine infection encountered in the endometrium, generally lacking any kind of clinical manifestation, not only the systemic manifestation, but also the local manifestation also. You have observed that in each and every category of the uterine infection, either systemic illness is there or not, but local manifestation of that infection is there in terms of discharge. But here, either there won't be any discharge, or if discharge is there won't be any abnormality in the discharge. It will be exactly transparent as we observed in case of estrus stage of the physiology. Okay, so generally animal will be clinically healthy or apparently healthy, but the most important point of the diagnosis in this particular condition, animal will express the failure of the conception, or animal will be repeating after each and every insemination. Okay, so particularly animal will be exposed to the RBS or repeat breeding condition, and generally such kind of uterine infection can be diagnosed based on the cytological evaluation, and detail of this diagnosis we will be discussing in the diagnosis section based on the polymorphonuclear cells in the cytological smear. And last type of the uterine infection is the pyometra. Generally, it is defined as the progressive accumulation of the pus because the purulent content will be increasing with the advancement of the infection. And usually it is associated with the persistent corpus luteum. And due to the persistent corpus luteum, animal will be anestrus in the expression. Okay. So this condition may occur postpartum when animal is suffering from the endometritis, and at this particular point ovulation is there and formation of corpus luteum is there. Okay, so due to the progesterone dominance, the flourish of the contamination or infection will be there, and animal will be manifesting in the terms of pyometra. And post-service pyometra is also common due to the trichomonas infection. So ultimately, the incidence of all these uterine infection can be categorized in this category, in this range. And here you can see the highest incidence is being observed in case of subclinical endometritis. And this is the main cause of repeating of the animal, or we can say the failure of the reproduction. So now we will be discussing what are the different predisposing factor and what is the etiology behind the uterine infection. So basically, as we have discussed, that during the event of parturition, the structural and somewhat the functional barrier in terms of pH of the reproductive tract. Some chemical ingredients and compositions are there in the reproductive tracts which are creating barrier for the microbial contamination. But during the event of calving, such structural and functional barrier are breached. So it is very most favorable time for the microbial organism to enter in the reproductive tract. And secondly, we generally support the microbial organism by providing the unhygienic environment or circumstances during the event of parturition. Okay, so if post-parturition condition are not sanitary, not properly managed or scientifically managed, then those microbial organism will have this favorable opportunity to grow or enter inside the uterine layers. Third predisposing factor is nutritional deficiency. As we can say, this is a very critical physiological stage of the animal, and animal is likely to face the negative energy balance in the postpartum period, because during this particular period the milk production is supposed to be increased or resume. Okay, so maximum energy will be consumed in the production of the milk, okay, or in nurturing the newborn also. So generally animal will be prone for the nutritional deficiency, and if we are not meeting this nutritional requirement of the animal through the roughage, concentrate, mineral mixture and antioxidant supplement, so ultimately the animal immunity will be compromised. Generally, it is also compromised at the old stage of the animal if animal is having very high parity, suppose 6th parity, 8th parity, 10th parity. So at this particular period also animal is having low immunity status, and additionally we are aggravating the low immunity status by restricting or not managing the balanced ration of the postpartum period. Okay, and further, due to all these conditions, if animal is being suffered with any kind of metabolic disorder like calcium, phosphorus, vitamin deficiency, or we can say milk fever, ketosis, or animal is exposed to any obstetrical disorder like dystocia, retention of fetal membrane, prolapse of the genital tract in prepartum or postpartum period, or we can say abortion, all those conditions will add on in the physical breach, injury of the reproductive tissues, which will make the tissues more susceptible for the adherence to the microbial organism or microbial contamination. Okay, and last, the predisposing factor, but not the least, the poor practices for the artificial insemination, or we can say intrauterine medication. Generally, in the field condition, we do not prefer to wash the perineal area before attempting any insemination process or intrauterine medication. Okay, washing or cleaning of the labia, vulval tissue, perineal area, or if during the procedure of the insemination or the medication, if animal is defecating, and this particular defecating material is adhering to the insemination gun or catheter, then sometimes we ignore the cleaning, and such kind of poor practices are exposing the animal for development of the uterine infection. So all these are the predisposing factors, and this particular figure depicting how the particular animal is susceptible for the microbial contamination. Way back, it was assumed or believed that during the event of parturition, the condition of uterus is completely sterile. Means there is no microbial contamination or microbial presence in the uterine lumen. But later on, with the advancement of the experiment and the science, it was evident that each and every uterus is having habitat of the microbial organism during the event of parturition. Means normally, whether animal is going to develop postpartum uterine infection or not, but animal will be having definitely the microbial colonies in the uterine lumens. Okay, sometimes they are favorable, sometimes they are inhabited to the uterine tissue, and sometimes they are pathogenic in the nature. So you can see at the event of the parturition, all the uterus is having the microbial contamination. Percentage of the animal means all the 100% animals are having microbial contamination. Thereafter, after the during the advancement of the postpartum period, animals which are having good immunity, good animal husbandry practices, good hygienic environment or feeding practices, they will gradually develop or they will gradually tackle the presence of microbial organism, and they will transform in the normal endometrium. Means endometrium or uterine tissues without the pathogenic microbial organism. And if we fail to provide such optimum conditions and environment, then ultimately either animal will be exposed to the metritis, or we can say endometritis, or most commonly the subclinical endometritis. Any category of uterine infection can be uh, threatened to the animal if we are not taking care all the predisposing factor and etiological agents. So what are the common microbial agents are there? We can categorize all the microbial agent in three categories. Recognized pathogen which are associated with the endometrial lesion. These are the common microbes, and most commonly the E. coli and the Arachnobacterium group. Rest all are also associated with lesion, but most commonly these two bacteria will be associated with the uterine infection. These are the potential pathogen, frequently isolated, but they are not generally cause any disease or pathogenesis in case of uterine infection. And these are the opportunistic organism, and they can be entered in the favorable condition, but generally they are not been associated with the event of endometritis. And this is the summary. These are the various risk factor as we have discussed related to the obstetrical disorder, nature of the calf, dystocia, and parity, as the old age is likely known for the less level of the immunity. Metabolic disorder, calving season is also affected based on the nutrient availability and the taking care during the event of parturition, and angle of vulva also. If angle of vulva is not vertical, or it having angulation to in the horizontal manner, then obviously the cleaning of uterus will be compromised. Or excretory, as we all are aware that the reproductive tract, or after the urethral orifice, it is the common tract for the excretory as well as the genital secretion. So if any angulation or inclination of the vulva will be there, so animal will be more prone to develop the uterine infection. Now we will see the pathogenesis part. So we are considering the after the parturition or calving incidence, the invasion of the microbial organism is a common phenomenon. Whether animal is going to have uterine infection or not, but bacterial invasion will be there. Those bacterial invasion or those bacterial population will release certain peptides or polysaccharide, or we can say the molecules. So these are the pathogen associated molecular patterns. These molecules will exposed to the endometrial cells, and these endometrial cells are having pathogen recognition receptors. Okay, and these are the different kinds of receptors which will identify the different secretory molecule from the microbial organism. And after the identification, those activation of the toll-like receptors will be there, and they will release the pro-inflammatory cytokine. Okay, like interferon 2, or we can interferon gamma, or we can say tumor necrosis factor, and various cytokines, interleukin 6, interleukin 10, all pro-inflammatory cytokines or chemokines are there. Those cytokine will chemo attract the neutrophils and other immune cells, and those cells will be helpful for the bacterial elimination or neutralization. And secondly, these cytokine will also be helpful to secrete the acute phase protein or antimicrobial peptide like beta defensin. And these peptide molecules or protein molecule will also be having a fight with the bacterial contamination. And finally, they will mitigate the bacterial invasion, or bacterial invasion will be there, but colonization of the microbial organism will be prevented. So this is how the normal uterus is supposed to be work. But due to the predisposing factors or the managemental condition, if we are not able to maintain uterine defense or host immunity on the higher side, then microbial pathogenicity will be win, and animal will be developed in the uterine infection. Okay, so this particular phenomena should be there in the ideal condition. If this ideal condition or optimum condition will not be followed, then this weighing will be high and microbial pathogenicity will be on higher side, and animal will develop postpartum uterine infection. So how we supposed to diagnose the uterine infection? Because for the therapeutic management, diagnosis is very much important. If we are not having good idea or clear cut identification of the pathogen or the infection, then the therapeutic management will be unsuccessful. So very first step of the reproductive diagnosis is we supposed to have complete and detailed reproductive history regarding the past as well as the current reproduction. What is the number of parity? How was the last parity? It was eutokia or dystocia. Whether the occurrence of RFM was there or not. Any uterine infection was there in history or not. If uterine infection was there, then how you manage the uterine infection? What sort of antibiotic, what sort of therapeutic management you adopted in the past for the uterine infection? Any other reproductive disorder in particular animal? Any metabolic disorder? A complete history should be obtained. So accordingly, we can have idea about the competency of the animal to fight the infection or to develop the infection. Second step will be physical and the clinical examination. Physical examination will be give idea about the body condition score of the animal, general appetite, general health of a particular animal. Then vital parameters supposed to be recorded like rectal temperature, pulse, mucous membrane. All those recordings should be there. It will give the systemic illness or systemic signs of the particular condition. Then visual infection particular to the uterine infection. So we can check the perineum part if any discharge or secretion is adhered to there or not. Vulvar opening, okay, purulent discharge or mucopurulent nature of the uterine discharge is there. If it is not there, slightly we can widen apart the labial opening or we can present the staining of the uterine discharge or purulent discharge. If we are not getting any kind of staining, any kind of uterine discharge at the external part of the reproductive tract, then we can go for the vaginoscopic examination. Okay, vaginal speculum or vaginoscope can be used. And if animal is suffering from the uterine infection, generally cervix is slightly open and it is leaking inside the fornix or the vaginal cavity. So when we will be having examination through the vaginoscopy or vaginospeculum, definitely we will be having some getting some presence of the purulent or mucopurulent material in the vaginal cavity. Thereafter, we can also go for rectal examination because it will give exact idea about the uterus, whether uterus is completely involuted or not, whether it is enlarged in the size, what is the consistency of the uterine wall, it is flaccid, it is toned, it is thickened, what kind of nature is there, it is duggy in the palpation. Okay, and if we will perform the back racking, obviously if any accumulation of fluid content is there, it will be evacuated through the vaginal opening. So we will be having the discharge after the back racking. Finally, USG examination is very important technique to have idea about the uterine infection because it will give clear idea about the presence of fluid in the uterine lumen, endometrium thickness, or we can say echogenicity of the uterine wall. If echogenicity of the uterine wall is increasing from hypoechoic to the hyperechoic in the nature, so obviously it will indicating that the tissues are inflamed in the nature. Okay. Then examination of the vaginal content. Either we can have vaginal content through manually, we can insert our hand in the vaginal cavity and whatever the purulent content is there, we can retract it back. Or we can also go for the Metritis device, which is very specialized device, which can be helpful for the collection of the vaginal content or uterine content. Next is the white side test. We will be discussing how we can conduct it. Then endometrial biopsy, cytobreast examination, and some metabolic cues are also there, which are generally being helpful in case of large scale of the dairy farming, where individual animal examination is not possible. Suppose you are having 100 animal, 500 animals, so each and every animal cannot be examined. So NEFA, BHBA, and alkaline phosphatase can be also be screened to get any idea about the uterine infection. So these are the condition. In the visual examination, you can see external part. Vaginoscopic examination, you can collect the mucus part or purulent discharge and you can grade the infection. Here, like uterine discharge is almost transparent. Here you can see the flax. Here the first part is very more than 50%, and here the maximum part as a purulent content. So it is also giving idea about the degree and nature of the infection. This is the digital vaginoscope, which can be used full for the visualizing the vaginal cavity or the cervix part, and this can be easily be connected with the Android phone, and each and every aspect of the internal structure can be visualized in our phone itself. Rectal palpation, as we have discussed, the characteristic differentiating feature can be observed. This is the device which we have discussed about Metri check. So Metri check can also be utilized for the collection of the purulent content, and based on the nature of the purulent content, we can classify the uterine infection as we have observed here. Thereafter, the ultrasonography examination. Here you can see this the cross section of uterine horn. It's completely closed. We are not detecting any fluid content in the uterine lumen, but here you can see the small amount of fluid is there. Okay, so generally the fluid presence of the anechoic fluid in the uterine lumen is indicating either animal is experiencing the stage of estrus or it is experiencing the stage of endometritis. So based on the reproductive history, we can have idea whether animal is going from estrus or any uterine infection. This is the picture of pyometra. Such kind of anechoic accumulation in the uterine lumen can be observed. Here also the anechoic fluid is observed. And this is about the endometrial biopsy. Okay. Basically, endometrial biopsy is not generally being used in the field condition, but it is the gold standard diagnostic technique for any kind of uterine infection. However, it will require a lot of practice to be take a successful biopsy sample from the uterine tissue, because any error or mistake itself will cause injury to the uterus and the uterine infection will be developed. Okay, so we supposed to be very careful while doing the endometrial biopsy, and such kind of biopsy punch instrument can utilize for the taking histological sample for diagnosis of the uterine infection. Okay, and one point to be noted here that the pyometra and pregnancy generally having some similar conditions or similar manifestation while doing the rectal palpation. So one supposed to be differentially diagnose both the condition based on the Dougie palpation, because the tonicity or what elasticity you will observe in the pregnant uterus, such kind of elasticity will be missing in case of pyometra. So it will be Dougie in the palpation, fremitus and placentum will be missing. Okay, and thinning and thickening of uterine wall is also a differentiating feature between pyometra and the pregnancy. This is about the cytobreast technology. Because the endometrial biopsy is somewhat causing injury or damage to the uterus, so it is also kind of corroborated technique, or we can say modified technique, which is less causing injury to the uterine tissue and giving good satisfactory, or we can say very good result in terms of diagnosis. So such kind of cytobreast assembly can be used, and this is the disposable breast which can be attached at the tip of the this cytobreast barrel, and thereafter we can insert in the endometrium or uterine cavity, and finally after touching to the wall of endometrium we can have circular, or we can say clockwise or anti-clockwise motion or rotatory motion, and thereafter these bristles will be having superficial collection of the endometrial cells and the discharge, and further this discharge can be collected and a smear can be prepared of the clean grease free microslide, and this smear can be stained and observed under the microscope, and based on the PMN percentage, or we can say neutrophil counts, we can have idea about the status of the uterine infection. If we are getting more than 18% of the PMN cells at this particular window, so animal will be categorized positive for the infection. Or if we are having this much, according to this particular window, again animal will be classified. So based on the numerical benchmark of the PMN cell, we can categorize the uterine infection. This is very classical test, or we can say very simple test, and previously it was used very often, but nowadays generally people don't prefer to use it. But it is very useful, or less resource setting will be required to use this test. So simply you supposed to collect a cervical mucus or uterine lavage, whatever the facility you are having, and same volume of the NaOH or KO solution can be used. And thereafter, suppose you are taking 2 ml lavage or 2 ml discharge, then 2 ml sodium hydroxide solution, then you supposed to boil, and after the boiling just cool down the content and observe the color change. If there is no change in the color, so it will indicating that there is no uterine infection. If slight yellow color, then mild category of the infection. If dark yellow color, then severe category of the infection is there in particular animal. So it can easily performed in the field condition, and we can rule out the subclinical endometritis. Generally, whatever kind of diagnostic technique we are discussing, mostly they are useful in case of subclinical endometritis. Because in case of metritis or pyometra or clinical endometritis, generally the purulent or mucopurulent or any category of abnormal discharge will be there. But in case of subclinical endometritis, generally the local as well as systemic manifestation will be missing. The diagnostic tool or role of the diagnostic technique will be very much important in such uterine infection. So now we will discuss what is the therapeutic management after the diagnosis. Suppose we have diagnosed a particular condition that this particular animal is suffering from this particular uterine infection, whether it is puerperal or pyometra or endometritis, then this particular line of treatment supposed to be followed to cure the animal from the uterine infection. First, we supposed to eliminate the microbial infection, and for elimination of the microbial infection, we supposed to use the broad spectrum antibiotic. It may be used in the parenteral or systemic route, or we can also go for intrauterine route also. But here also two school of thoughts are there, or we can say it is a debatable issue that which route is more effective in case of uterine infection, whether we should go for parenteral or intrauterine. So certain conditions are there where intrauterine administration of the antibiotic will not be effective, specifically in case of puerperal metritis, or we can say in the early postpartum period, where the volume of uterine content is very huge, or we can say the overall surface area of the uterine tissues are very high. Okay, so if we are infusing 60 ml, 100 ml antibiotic, it will not going to have any effect over the microbial contamination. Okay, so generally in case of very high purulent material is there, very voluminous purulent material is there, or high surface area of uterine tissues are there, then in such condition, intrauterine administration is not been recommended. Okay, so in such condition, to achieve the MIC or minimum inhibitory concentration of the antimicrobial agent, we supposed to go for the systemic route. Okay, second step or target will be evacuation of the uterus. In one approach, we are eliminating the microbial contamination, or we are neutralizing the microbial contamination. In the second approach, we supposed to strengthen the uterine contraction. So whatever the content are there in the uterus, it's supposed to be evacuated itself. So uterine ecbolic agent like oxytocin, ergometrin can also be utilized. If corpus luteum is positive or present over the ovary, then we can use the prostaglandin. Or for if uterus is not itself is evacuating due to any reason, then we can also go for uterine lavage. Manually, we can evacuate the uterine content by using NS. We can also mix the metronidazole or iodine solution also. Reduce the inflammatory condition. We can also go for NSAID or antihistaminic. Supportive care or immunity boosting is also imperative in case of management of uterine infection. Okay, because we are fighting with the microbial contamination, but we should also boost the body immunity. So body will also fight parallelly to the microbial contamination, so the recovery will be faster. Okay, so fluid therapy, uterine stimulant, whatever the herbal formulations are there in the market, multivitamin, minerals, antioxidants should be used to boost the animal immunity, like vitamin E, selenium, ascorbic acid, and many herbal formulations are also there. You might have observed that after the parturition, generally people are preparing some kada, some herbal content are mixing, they are boiling at a certain period, and they are offering to the animal. And after the recovery from the uterine infection, we should not take the rest. We should follow up that particular case, because reoccurrence is also high in case of postpartum uterine infection. So after the recovery, we supposed to induce or short the cycle. And as the animal is induced the estrus, it's supposed to be inseminated. Okay. So estrus induction is also kind of a cleaning activity, or we can say boosting the uterine immunity for the animal. So it will be helpful to manage the uterine infection. So this is how we can go for uterine lavage, as you can see. And choice of antibiotic or broad spectrum antimicrobial is very much critical in case of uterine infection, as we are entering in the era of One Health, or we can say the very high incidence or problem we are facing about the AMR, antimicrobial resistance. So blindly using any antibiotic generally will not suffice our purpose. So we suppose to go in a selective approach. So it is better to collect the uterine discharge and go for the culture sensitivity test. And based on the result of CST, we supposed to choose our antibiotic. If we have already lapsed this many days, then 2-3 days may also be added in this duration. If we are choosing the right antibiotic, obviously it will be less harmful for the uterine environment and more beneficial for animal as well as the dairy farming also. So these two major category of antibiotics are also, any category can be utilized based on the experience or the result. Generally, bactericidal category of the antimicrobial agents are being preferred, and any alone or combination of the antimicrobial agent can also be utilized. But we supposed to keep on this point that antibiotics are not substitute for the sanitary or hygienic management during the transition period, but these are the valuable addition whenever we are need for this addition. Okay, so we should not compromise the sanitary and hygienic condition during the transition period in umbrella of the antibiotic use. Generally, people are also talking about some alternative therapies. In addition to the antibiotic, these are the some alternative therapies which we can use. Different group of people has used those antimicrobial agents, or we can say some alternative therapies, and they have got some variable success for the uterine infection, like lipopolysaccharide, oyster glycogen, cholesterol whey, serum, autologous or homologous serum, leukotriene, or granulocyte macrophage colony stimulating factor, or we can say PMN extract. All those agents are boosting the uterine immunity. Okay, they will boost the cellular as well as the chemokine immunity of the uterine system, and it will be helpful for the combating the microbial contamination. In the second category, these are the some antioxidant and hypertonic solution, and the bacteriophages can also be utilized. They are also having some antibacterial or antimicrobial properties. So they will also neutralize the microbial population in the uterine lumen through the oxidization, as we can see in case of ozone. Probiotics are also there. These will compete with the nutritional availability of the pathogenic microflora. Okay, so these agents can also be utilized, and some herbal formulation is also preferred in case of uterine infection, like neem oil, tinospora, and garlic extract. However, the success rate is variable, and the most common hindrance in these alternative therapies are the availability of the agents and preparation of these agents, because all these ingredients we are discussing, they are not ready to use. And whatever the antimicrobials we are having in the market, all these ingredients are ready to use, so they are more convenient for us. So that's why generally we go for antibiotics. But if someone is interested, then these things can also be tried. And platelet rich plasma is also very much beneficial to treat the subclinical endometritis. So suppose we are treating the 10 animals, so it is not likely that all the 10 animal will be giving response for the antimicrobial therapy or postpartum uterine infection. Okay, so why this variation is we are getting this variation? So we are getting this variation because of the antimicrobial resistance. We are not testing a particular animal for the resistance profile. What sort of antibiotic are sensitive for a particular animal, which are intermediately sensitive, which are very resistant to a particular animal. Or indiscriminate use of antimicrobial agents are reducing the success of this particular therapeutic protocol. And secondly, biofilm formation is also evident in case of uterine tissues. Whatever the antimicrobial agents we are having, they are studied with respect to the planktonic form of the microorganism, means single or free living format. But in case of resistance, or we can say biofilm formation, they are clubbing to each other and they are synthesizing a biofilm around them. This particular biofilm will be inhibiting the penetration of the antimicrobial agents, and that's why the success rate and the recovery of a particular animal will also be lower down. So this is how we can understand when we will infuse the antibiotic, this penetration of antibiotic will be compromised by this particular layer of the biofilm. Okay, so penetration will be compromised. And secondly, the whatever the microbial organisms are there inside the biofilm, they are having reduced growth rate. So in the reduced growth rate microenvironment, generally antibiotic will not be very much effective. Okay, and they will be dormant in the stage, or whenever the favorable environment will be there, they will start multiplication, and then they will burst the biofilm, and they will release, and they will spread the infection in any possible way. So how we can manage such kind of biofilm formation or resistance due to the biofilm? So these approaches can be used. Either we can inhibit the biofilm formation for selective and discriminate use of the antimicrobial agent. If biofilm formation is there, we can disperse the biofilm by using a suitable agents like antimicrobial peptide, quaternary ammonium compound, phenazine, and nitric oxide releasing antibiotic. Or we can eradicate by using the N-acetylcysteine, hydrogen peroxide, or we can use also tris plus disodium EDTA. And out of all these ingredients, N-acetylcysteine is very much effective in case of biofilm formation. If we are using 3.3% N-acetylcysteine in a 30 ml volume, along or in addition to the routine antibiotic. So suppose you are facing a very challenging animal that after multiple or very high degree or broad spectrum antibiotic use, animal is not curing for the postpartum uterine infection, then you can try such kind of modality. You can add the antibiotic preparation with the N-acetylcysteine 3.3% with 30 ml volume. Obviously, if biofilm formation issue is there, it will be resolved, and surely you will get the success in curing the uterine infection. Now we will discuss the final part of today's discussion. This is about the prevention, because prevention is always better to manage the treatment aspect. So these are the risk factors which we have discussed, and if we are successfully manage these risk factors through providing the optimal environment, housing, and calving assistance, okay, whatever the changing needs are required in the diet, we are changing all these nutritional requirements, prophylactic therapeutic management, and key monitoring or very close monitoring of the animal will be helpful to adopt the preventive measure in a better spirit. So if we are adopting all those preventive measures, obviously the incidence and occurrence of postpartum uterine infection will be less, and this particular management will be important during the transition period. So what is the transition or periparturient period? It is very clearly defined 3 weeks before and 3 weeks after the parturition. Okay, and this particular period is very turning point for the reproductive disorders. Generally, farmer is not very aware during the last month of the parturition, because animal is not productive in this particular stage. Okay, so we should not ignore the animal in this particular stage, and transition period should very critically monitored or managed. If we are successfully managing the transition period, believe me, we are inhibiting or preventing 95% issues of the reproduction, which we are going to be faced after the event of calving. Or not only the reproductive issue, but also we are able to curtail the metabolic issues also. Okay, so proper energy balance should be maintained, a mineral mixture supplement, antioxidant supplement, proper housing condition should be provided, calving condition should be properly scientifically managed, grouping of animals should also be adequately managed, and very balanced nutritional ration should be provided to the animal, because in this particular stage, animal is transforming from non-lactating pregnant to the lactating and non-pregnant stage. So a vast and huge physiological transformation is going to be happen in this particular period. So animal is already going through very high oxidative stress at the physiological level, and immunity potential of animal is also being compromised during this particular window. Okay, so and appetite of animal is also not optimum during this period. So whatever the dry matter we are providing, whatever the feed we are providing, it should be densified. Means it should be less bulky, but more energy or more nutrition in the particular feed should be there. Okay, and dietary cation anion difference should also be managed. Okay, so canine and cation and anion balance in the mineral mixture and diet should be taken care to avoid any kind of metabolic predisposition of the animal. And obviously, ultimately, if immunity will be improved or maintained optimally, then the occurrence of postpartum uterine infection can be reduced. So how we can maintain? As we have discussed, housing and hygienic condition, polyherbal supplementation can be provided during the event of parturition. Generally, people will prefer to prepare a kada of ajwain, methi, sont, salt, bamboo leaves, molasses. So all these things which we are using from a very traditional aspect, they are very beneficial for the uterine involution, its cleaning, expulsion of the placenta, because retain fetal membrane is very important condition which are exposing the animal for the uterine infection. If any animal is experiencing the delay in the evacuating the fetal membrane or the placenta, so likely chances are there that in the future days animal will be suffering from the uterine infection. So by using such kind of polyherbal supplementation, we supposed to reduce the incidence of the ROP. Additionally, we can supplement the animal with ecbolic agent, calcium supplement, balanced ration. All these things should be utilized. So in this 5M principle, we can cater the preventive measures of the uterine infection. If we are catering all these aspects of the prevention, obviously the incidence of uterine infection will be very much minimized. So, nutshell, we can discuss this preventive protocol after the calving. If you are adopting the preventive measures, what we have discussed, and simultaneously you supposed to monitor the temperature at least for 1 week. If you are recording the fever, it is indicating that after the adopting so much care, animal is exposed to the some degree of uterine infection. So immediately we supposed to give the long acting broad spectrum antibiotic along with the supportive and the NSAID. Okay, and animal should be taken care accordingly. If we are not recording any kind of high temperature in the animal, then again animal should be examined after 2 weeks. Again, if animal is normal, each and everything, feeding, behavior, temperature, each and everything is normal, again animal should be monitored after 4 to 8 weeks. At this particular stage, we should not only monitor the animal on the systemic aspect, but also we should evaluate the reproductive health of animal also. That uterine involution is completed or not, animal is entered in the cyclicity or not. If animal is entered in the cyclicity, means ovulation or formation of the corpus luteum is evident, then we supposed to inseminate the animal just after the completion of voluntary wetting period. If animal is non-cycling but systemically healthy animal, then we can think about the induction of estrus through using of the hormone protocol, and fixed time insemination can be used after the voluntary wetting period. So this is how we can manage the postpartum uterine infection in, or we can conclude our discussion that very importantly we should avoid the negative energy balance through using the proper balanced ration, and decade is very important for preventing the metabolic disorder in the particular animal, because metabolic disorder are also linked with the reproductive diseases. And RFM is whatever the obstetrical disorder we have discussed, like dystocia, abortion, uterine torsion, the RFM is the most critical factor. It is having highest odds ratio which is affecting the uterine infection. And after adopting all those preventive measures, if we are getting the uterine infection, we supposed to diagnose it very correctly. We should know the pathogen, which particular pathogen is affecting, or we can say indirectly which particular antibiotic is working. If we are not able to identify the pathogen, we supposed to identify the working antibiotic for a particular animal. Then accordingly, we supposed to treat the animal by adopting these 5 principles as we have discussed in the therapeutic section. And finally, awareness is very valuable. We always supposed to aware our farmer that how to manage the animal in minimum incidence of the postpartum uterine infection, so that our dairy farming can be sustainable for us as well as our farmer also. Thank you. I have completed from my side. If any question is there, I am happy.
Uh, Thank you so much, sir. Dear participants, if you have any query, you can ask.